Cancer is something that a lot of people just, cross their fingers and hope they don't get. For me, I know it's more likely in my family that it could happen. So anything that I can do to be proactive and get out in front of it, I see as a win.
Jamey Parker doesn't have cancer, but both of her parents are cancer survivors, and that's what led her to see a genetic counselor.
A lot of what I do is identifying families that have a genetic or inherited risk for cancer, and finding out that a family has a risk for cancer allows us to be more preventative or proactive with their medical care.
They went back 2 generations in Jamey's family history. Her father showed a genetic variant that indicates increased risk for cancer, and that led to the discovery that Jamey has the same gene.
So depending on which gene is involved, it allows me to communicate to the patient what types of cancers they're at increased risk for, in many cases how high those risks are, and also what to do about that.
Like many genetic counseling patients, breast cancer is highest on Jamey's risk assessment, but she also has a predisposition to colon cancer and stomach cancer.
It's kind of sobering when you first hear that you have a genetic propensity for cancer. It took a minute to process, and it's not just impacting me, it's of course impacting my children as well.
Because of her risk level, Jamey now qualifies for accelerated screenings, and she's taking advantage of resources to reduce her risk.
I have a counselor, and we meet multiple times a year, and we talk about my holistic health, how we're going to approach that, and that includes screenings and medicines and nutrition and anything that I can do to be proactive.
Genetic counseling is not for everyone.
Is this information you want to know about yourself, or is this going to be something that ultimately is more stressful or more damaging to you to just know that you have this risk?
But for Jamey Parker, forewarned is forearmed.
At the end of the day, it is what it is, and if I have a tool that I can use to fight cancer, then I'm happy to have that tool in my toolbox.